Sure. Good morning, everyone. My name is Meghan Haynes. I'm Public Health Planner for El Paso County Public Health. And I'm joined by my colleague, Kelsey Leva, and we are going to take an opportunity to dig a little deeper around our youth suicide prevention efforts. So that's what Kelsey and I will be speaking to in the next couple of slides. So next slide, please.
Thanks, Meghan.
Want to provide just some additional data that wasn't captured as part of Dr. Kelly's presentation. This is Healthy Kids Colorado survey data for El Paso County. And what you see represented here on the slide are the suicide indicators that are part of that survey. That survey is administered to middle school and high school students in the county. It's done on an every other year basis. And so we have 3 years worth of data represented on this slide for the years 2013, 2017, and 2019. Starting from the far left, you see the numbers around attempted suicide one or more times in the past year. The middle section is made a plan about how to attempt suicide in the last year. And then on the far right there, seriously considered attempting suicide in the past year. The big takeaways from this slide are that 2019, which is our most recently available year of data, are the numbers trended very similarly to 2017 across these indicators. Our latest survey results indicated that roughly 1 in 5 young people seriously considered attempting suicide during the past year. 1 in 6 made a plan about how to attempt suicide. And then almost 1 in 10 attempted suicide at least one time in the past year.
That's shocking. Yeah.
I'm just going to jump in. Are you?
No, go ahead.
Going to move on?
Yeah.
One of the important things, and I'm making a promotion here for this survey. When we get to present with Dr. Kelly, he always has all the beautiful and sexy data slides, which I actually have a little data envy when he does that. But we in the preventive realm, or sometimes in healthcare, because of the way we have to aggregate data and protect people's privacy, it can be a little bit more difficult to really get a pulse on what's happening in our community. This survey is a beautiful opportunity for that to occur so that we can look upstream and say, before we get to the tip of the spear, which is, that fatality, what can we do up that river to really begin to impact and understand what are the trends, what is happening in our culture. You'll see there was a blip here. We don't have any data from 2015, and we didn't have enough schools who had enrolled in this survey to have an appropriate data sampling. And so one of the things that I just want to really promote here is that we as a community really understand and support our schools in participating in this survey so that we have the information we need moving forward in these preventive efforts.
Tom.
Sure. Go ahead, David.
So what jumped out to me, Megan, was in the column on the left, the attempted suicides is pretty much doubled from, 13 to 19?
Yeah.
But then you mentioned something about, well, maybe, 1 year we didn't have enough schools to even get the data. So it's not always the same schools, like the one we see 5.3, there might be different schools involved in 9.7?
Correct. So the sampling looks different from each survey administration. It is a recruitment process in which the survey administrators work with local school districts to determine who will participate. There are some partners who remain consistent year to year because they value participation, they value having their own data to track through every iteration of the survey. But you're correct, the sample does change slightly from each survey administration.
Okay. And then perhaps this is what you're going to address in another slide, but what is your explanation for a doubling in attempted suicides in, 6 years? A 6-year period?
So
that's an easy question, I'm sure.
Right.
Yeah.
And my answer right away is that suicide is a very complex issue, obviously. We paint a fairly good picture of what we understand to be the case with our data, but it doesn't always capture some of those more complex underlying factors that could be driving suicide ideation, suicide attempt, suicide completion in our community. It's multi-factor in nature, and we'll get into a little bit some of the different efforts that we are working on in public health to address it from that standpoint of knowing that there are just a number of things that can impact this issue.
Do you have one or two that you think are the big ones? Hey, this is why we think it's doubled in 6 years.
Well, so I will tell you, I have been working in youth suicide prevention for a little over 5 years now, and the number has changed significantly over that 5-year period as well. So as Dr. Kelly referenced, when the Child Fatality Review Team began convening in 2014, we saw an increased incidence in youth suicide in 2015, 2016. But through our collective efforts as a community, we were really able to bring the rates down in 2017, 2018, 2019. Through our child fatality review process, we see a number of individual level factors that are impacting young people, family and social discord. They go through a lot of changes. They face a lot of difficulties and struggles in their home life, family life, perhaps in their school life. And then, young people are facing very significant issues in this past year with COVID and all of the stresses and challenges that come along with that. And so I can't point to exactly, even one or two factors. For each individual, their circumstances are going to be different, but they are often sharing some of those difficulties and having, tough times navigating those and finding the hope and resilience, although we're working very hard to build those protective factors around young people so that they don't see suicide as an option. For what is often a temporary crisis that once they navigate it, they go on to live a long and healthy life.
Mm-hmm. And this will be it for me, but if it's doubling, then it seems to me that something's getting worse, right? If you have twice as many children attempting suicide, the constant probably is, troubles in the family, things like that. But what is it that's causing it to double? What got worse over that 6-year period?
Right. And it's a very valid question, something that we're absolutely tracking through our work. Some other reflection on the data to perhaps consider is how far we've come as a community in terms of talking about this as an issue. So sometimes do we see an increased incidence in discussing making a plan or, attempting suicide or seriously considering suicide because we've made it more acceptable for young people to talk about that as something that they're dealing with and seeking help for that? Are we recording more incidences of that help seeking? And is that perhaps what is reflected in the data? That is just another factor that could be part of the picture is worth considering as well, I think, especially when we're talking about these more discrete data points that don't often tell that full story.
Attempted suicide, is that a documented attempted suicide where they went to the ER or their parents walked in and, they were attempting a suicide? Or is that just a reported, on a piece of paper, yeah, I tried something, no one knew about it?
Right. So for the Healthy Kids Colorado survey in particular, that is self-report. So this would be young people who are taking the survey, self-reporting, having attempted suicide. Certainly suicide attempt that results in an emergency room visit or in a hospitalization is also tracked, and we do have access to that information. And that is something that we're tracking as well. But to your point, not every suicide attempt is so injurious that it requires medical attention. And so that's why we need survey tools like this. We need data from the hospital system. We need partners to come together to be sharing that information so that we paint that most accurate picture.
This really will be my last question.
Sure.
Were these surveys anonymous when the kids fill them out?
Yes. So this is a completely anonymous survey. It in the past has been pencil and paper. In the most recent iteration, they were moving to a computer-based application. So I believe in the next iteration as well, they'll have that ability. And so kind of upping that technology as we move on and hoping to have more young people engage in the process and inform our prevention strategies.
Thank you.
You're welcome. All right.
Okay,
Next slide.
Megan, go ahead.
Yeah.
Can I just,
Thank you.
Wayne?
did you tell us what the percentage of kids of this age who did take it was?
No, I did not. We don't often get a report of the actual percentage of schools or number of students. You know, we don't get a lot of information about the actual sample. All we know is that it has to meet a certain threshold of participation for us to get county level results like this. So to Dr. Johnson's point earlier, in 2015, the sample size wasn't large enough for it to be reported on a county level. All of that data for the schools that did participate in 2015 stayed at the school level. It was not enough to aggregate and roll up into a county level reporting.
Okay, Megan.
All right, so this next slide here digs a little deeper around the particular question of students who attempted suicide one or more times during the last year. The graph on the left is for data for the years 2013, 2017, and 2019 again, male and female. So you'll see that data represented there. And then on the right-hand side, Councilwoman Avila, to your point earlier about the LGBTQ community, we have data for those who identify as gay, lesbian, or bisexual, heterosexual, and then unsure. So those are a breakdown of the demographics around this attempt question.
So are there numbers and or percentages, because it doesn't do me any good to hear over there and over here and that.
Sure, yes, and I will get to that in just a moment. I will break that down for you. So this is all to say that disparities between males and females continued in 2019 compared to 2013 and 2017. Higher rates of suicide attempts among females than males. But we know based on Dr. Kelly's presentation that rates of death by suicide are higher in males. So perhaps this gives us some insight into a shift in the youth data. Either there's an increased lethality of means being utilized by young women, different diagnoses or factors at play underlying the suicidal ideation and attempt. And then we know that incredible disparities persist among youth who identify as gay, lesbian, or bisexual compared to youth who identify as heterosexual or unsure. In 2019, nearly 1 in 4 participants who identified as gay, lesbian, or bisexual reported attempting suicide 1 or more times in the past year, compared to 1 in 15 participants who identify as heterosexual. So that's a huge disparity that we have seen play out in the data year to year, and something that we are very concerned about as part of our efforts and wanting to ensure that we're aligning our resources appropriately, that they are culturally relevant and culturally responsive to the LGBTQ community as we support those young people.
Yep, go ahead, Denise.
Yeah, I just noticed that the opposite gender in youth from the adult statistics that Dr. Kelly showed us, at least in terms of attempts, more female than male, whereas completed suicides in adults is more male than female.
Yeah, well, and I think, so it's really important to recognize, we have seen that in the emergency room, so I practiced 24 years, that there are historically more attempts, but when men do attempt, they tend to use more lethal means. And so they tend to be more successful. And so to Dr. Kelly's point, that and Dr. Wallace around firearms, though access to those lethal means, restricting that and finding ways to protect people who are struggling, but also then intervening so that they have the opportunity to, speak about it rather than have that one fatal event, if we could avoid it.
All right, next slide, please.
Okay, go.
So we'd like to talk a little more now about the Youth Suicide Prevention Work Group. So that is our largest effort around youth suicide prevention. We've been convening and facilitating this work group since July of 2016. So we're coming up on 5 years of convening of that group. It takes collective action in support of youth mental health and suicide prevention. And it's grown to involve more than 90 different community partners from various sectors across the county. The work group has a steering committee that oversees and supports implementation of community-driven strategies to prevent youth suicide and really reflects the cross-sector collaboration that's necessary to address this complex issue. Partners involved in the work group and steering committee include youth serving organizations, school districts, behavioral health organizations, hospital systems, our nonprofits that address mental health and suicide prevention, and faith-based organizations, among others. And then I am going to go ahead and turn it over to Kelsey to talk a little bit more about our efforts.
Thanks, Kelsey. Welcome.
Thank you. I'm Kelsey Leva. I'm the Youth Health and Development Planner for El Paso County Public Health, and I've been working with Meghan on this topic for several years. And if we could go to the next slide, please. Wanted to share with all of you a little bit about our efforts in 2020 and 2021 with the community and with our partners in this work group. In 2020, we were able to shift that work to a virtual space pretty quickly and continue to meet throughout the year, both with our steering committee and with our community partners. And they remained very dedicated and participated really fully throughout the year. In fact, even at some points increasing the frequency of our meetings because we were very concerned and focused on supporting young people during this challenging season of our lives during the pandemic. In 2021, we knew from our work with Dr. Kelly and the Child Fatality Review Team that we had seen an increase in the number of youth suicide deaths in the previous year. And so we took some time as a group to really reflect and understand to the best of our ability what young people were experiencing and how we should shift our work to better serve them. So at the very beginning of the year in January, we prioritized these suicide case reviews with our Child Fatality Review Team and accelerated the process. So what would normally be done towards the end of the year, the following year, we got done in the first quarter of the year with that team, meeting more often and making sure that we reviewed those cases thoroughly to then have information to share back with our partners in the youth suicide prevention work group. So that was one thing we did. We also held a panel with young people from our community to hear from them directly about their experiences. After we did that listening and learning, and kind of concurrently with the case review process, we jumped into a new community gaps and needs assessment. We had previously done that when we first started the work group. It was time to reassess because the game had really changed and young people were experiencing some new things. So we completed that gaps and needs assessment process, and then we went kind of and prioritized them, which are the most important right now, and then what strengths do we have to address those gaps and needs, and where do we need to focus, and kind of, continue with that energy. April through May this year, we've been able to really dig into action. So instead of just, understanding the issue, now we're talking about a community action plan, and our partners are putting skin in the game around, this is what I'm going to do. This is what we're going to do. These are the goals we have together. So we have a new 2021 Youth Suicide Prevention Work Group Community Action Plan. And through the rest of this year, we'll be kind of checking in on that action plan and problem solving. And I want to share a couple of the things in that action plan just so that it's more tangible for all of you. We are working to increase the utilization of a universal release of information so that information sharing is happening among different agencies that serve youth in the community, be that schools or behavioral health or, anything like that. We are working on additional parent-led resources that are informed by local parents about this topic and how you can find help and where to go for that help, what to look for, things like that. And then we also have some really cool innovative partnerships with the faith community that are happening this year in our action plan around connecting youth to counseling services when they need them. Next slide, please. So wanted to take just a quick moment before we hand it off to Dr. Johnson in the next couple slides to share with all of you some ways that we can all be part of preventing suicide. It really is everyone's job to do this. And one of the first things that we can do is change the way that we talk about suicide and normalize seeking help and hope, telling those stories of hope and sharing our personal stories of challenge and elevating that in the media, things like that are really helpful to shift the conversation from the contagion piece of suicide, and it's very concerning, it is, but we do need to tell those stories of resilience as well. We can also change our language when we talk about suicide and avoid using terminology like completed suicide or committed suicide, or referring to a suicide as successful or unsuccessful or a failed attempt. And instead shift our language to say this person died by suicide or they attempted suicide. And when we do that, we make ourselves more available for that conversation when someone is experiencing suicidality, or if they've lost a loved one to suicide. And so that's a shift in our language that we can all make, and happy to chat more with you about that if you have questions as you're preparing to speak to the community. And then we also encourage everyone to attend a gatekeeper training, just a short session on how to have that conversation with someone who is struggling. It's challenging in that moment to look at someone and ask that difficult question, and it's important to take time to learn how to do that and practice it. So we would recommend the Question, Persuade, Refer Gatekeeper training. Next slide, please. And then last but not least, we want to share a few resources with you, because we know that you are in the community and hearing from people about this topic. It's something that has impacted us all very deeply. So we want to equip you with some resources that we find really helpful when having those conversations. The first three on this slide: the Protecting Youth from Suicide resource is a document written by parents, local parents, for parents. Beyond the Curve and Below the Surface are also resources that were informed by local youth. And these are very relevant to the current experience in our community in the last several years, and even in the last year. So these are great resources that are very locally driven that we would recommend you use when having those conversations in the community. Sure.
Quick question. So I believe, at least I know Councilmember Avila and myself received an email from the National Suicide Prevention and Action Month proclamation. Are you familiar with that group? They were inviting us to participate. It's a national organization, looked like a potential other resource, and we referred them to you. So.
Mm-hmm. Yeah, so we have participated in some local efforts that align with, proclamations around Suicide Prevention Awareness Month. It's usually in September, but that's something that we have done historically. We'd be happy to continue.
Yeah, it's called Hope for the Day.
Oh, okay, yeah.
Would you,
We are familiar with Hope for the Day.
Okay.
Yeah. Mm-hmm. Yeah. It's a good resource. It's always good to be opening that conversation about this issue in our community.
And apparently they partnered with Cerebus Brewing Company to do some work. So I think we sent them your way. I hope we
Okay.
did. Yeah.
Thank you. Thank you for doing that. I want to also remind everyone, Colorado Crisis Services is available 24/7 in Colorado. And you can access that by calling that number 1-844-493-8255, or you can text TALK to 38255. We also have a walk-in location here in Colorado Springs if you'd rather be in person. And
the walk-in location, what hours and days?
It's 24/7.
24/7. Okay.
Yes. Mm-hmm. And then the last thing we want to encourage all of you to do is, when you're having conversations in the community, or if you yourself are really passionate about this topic, we want to connect you to the Youth Suicide Prevention Work Group, and we want you to be involved. So just reach out to Public Health. We're happy to make that happen, and we encourage any new voices to come to the table and be part of this effort. So thank you.
Great. Thank you. Dr. Johnson?
Sure. So a couple other resources. So I turned it off so you wouldn't hear me breathe. A couple other resources. Our Youth Suicide Coalition is part of a broader consortium of suicide prevention that is headed through CHP. So we are looking at what is happening in the adult population, and particularly with the crisis more in our men than women. And so that has some additional resources. Plus, if you are with someone who is in a crisis, you can always call 911. We do have our community response team locally to Colorado Springs municipality area, and we have the Beacon unit, which is available throughout the county, and there is a unit that is specific for Fountain. that has just started as well. And those have been incredibly successful in linking people, again, from a point of crisis to the resources that they need at the time. So right care, right time, right place. And we have data from those units if ever you're interested, because they've been tremendously impactful.